Japan reports record a spike in potentially deadly bacterial infection. An electron micrograph of group A Streptococcus pidgin bacteria on primary human neutrophil. Group A strep is one of the main causes of STSS. CNN, the cases of dangerous and highly fatal bacterial infection have reached record levels in Japan, official figures show, with experts so far unable to pinpoint the reason for the rise. As of June 2nd, Japan's health ministry had recorded 977 cases of streptococcal toxic shock syndrome called STSS, which has a mortality rate of up to 30%. Some 77 people have died from the infection between January and March. The latest figures are available. The ongoing outbreak in Japan has already surpassed last year's previous record of 941 preliminary infections, the highest since statistics began in 1999. Japan's National Institute of Infectious Diseases reported 97 deaths due to STSS last year, the second highest number of fatalities in the past 6 years. STSS, the rare but serious bacterial infection that can develop when bacteria spread into deep tissues and the bloodstream. The patient initially suffer from fever, muscle pain, and vomiting, but symptoms can quickly turn life-threatening, with low blood pressure, swelling, and multiple organ failure as the body goes into shock. Even with the treatment, STSS can be deadly. Out of 10 people with STSS, as many as 3 people will die from the infection, according to the U.S. Centers for Disease Control and Prevention, called CDC. Most STSS cases are caused by the group A streptococcus, called GAS bacteria, which mainly produces fever and throat infections in children. In rare circumstances, strep A can become invade when bacterium produces a toxin that enables it to gain access to the bloodstream, causing serious illnesses such as toxic shock. Strep A can also cause flesh-eating, necrotizing facilities, which can lead to loss of limbs. However, most patients who contract the disease have other health factors that may lower their body's ability to fight infections, such as cancer or diabetes, according to the CDC. Invasive Group A strep infections are largely curbed by COVID-19 controls such as masking and social distancing, but after those measures are relaxed, many countries reported a rise in cases. In December 2022, the 5 European countries reported to the World Health Organization an increase in invasive group A streptococcus called IgAS, with children under 10 the most impacted. The CDC said it was also investigating the apparent increase in the disease at the time. In March, the Japanese authorities warned of the jump in STSS cases. Japan's National Institute of Infectious Diseases released a risk assessment, saying the number of STSS cases caused by the IgAS has increased since July 2023, especially among those under 50 years of age. The CDC says older people with the open wound are or at increased risk of contracting STSS, including those who have recently had surgery. However, experts don't know how the bacteria got into the body for nearly half of the people who get STSS, the CDC said on its website. The reason for this year's rise in cases of STSS in Japan remains unclear, according to Japan public broadcaster NHK. Professor Ken Kikuchi of Tokyo Women's Medical University told the NHK the rise could be due to the people's weakened immune systems following COVID. We can boost immunity if we are constantly exposed to the bacteria, but that mechanism was absent during the coronavirus pandemic, Kikuchi said. So more people are now susceptible to infection, and that may be one reason for the sharp rise in cases.